Now, the US drugs regulator has approved the sale of a new nasal spray to treat depression. Esketamine is intended for patients with treatment-resistant depression and can potentially start to work within 24 hours. Esketamine is a chemical mirror image of anesthetic ketamine, which is also abused as a recreational party drug and goes by the street nickname Special K. Some critics argue the drug was approved without adequate testing. Well, I'm joined now by Kim Wietzak, the consumer representative of the FDA Drug Advisory Committee. Kim, thanks so much for joining us here on the program. Now, you were one of two people on the advisory board against approving this new drug. Just tell us why.
Well, first of all, thanks for having me. Yes, I was one of the two people that voted against this drug because I didn't feel like the benefits outweighed the risks. There's a lot of potential future risks that we don't know about. And in addition, I don't think that, just the process of only having one of the clinical trials that, that showed the benefit, that it was over placebo. The other studies that they showed, the placebo outperformed the drug.
So you say that there are many risks that we don't know about, but what about the risks that we do know about? I mean, what are some of those dangers?
Well, the risk that we do know about is that sedating, because it is a tranquilizer that they have used in horses and other veterinarians, as well as it's a party drug. There's a disassociation, so you feel an hallucination that we do know about. And there were some things that we don't know about, like with some of the other antidepressants. There were a couple suicides. We don't know if there's potential risk there. We don't know about, is there a potential for addictive qualities of this drug as well, because again, it is a Schedule III drug that has had potential for, it's known as the party drug.
And of course, this is also very personal for you.
Mm-hmm. It is. I take my role as consumer representative on the FDA's Psychopharmacologic Drugs Advisory Committee really, really serious, because these approvals have real life consequences once it goes out into the real world. I got involved in this work not by choice. I like to call myself the accidental advocate. And I learned firsthand the importance of an FDA approval process with my own husband's story back in 2003.
We're just looking at some of the images of you and your husband. Could you share that story with us?
Sure. My husband, Woody, age 37, we're married almost 10 years. He had just started his dream job with a startup company and was having trouble sleeping. So he went to his general practitioner and was given Zoloft, which is an antidepressant for insomnia. And he was given sample pack, and within 5 weeks, Woody was gone. He had taken his own life. He hung himself. Woody was not depressed. He had no history of depression. And so when he was first found, just intuitively I knew something was wrong. But ironically, the front page of our newspaper had an article that said the UK finds link between antidepressants and suicide in teens. But what we didn't know is when we typed into Google Zoloft and suicide, that the FDA held hearings similar to what we just held, last month on this nasal spray. But it was in 1991, and there were all these links to suicide when it was just Prozac on the market. And at that time, the FDA did not, the advisory committee voted that there was no link. They didn't see any association with suicide. So they didn't do anything further about it, and the FDA didn't follow up on it. And 13 years later, in 2004, a year after my husband passed away, we got black box warnings for suicide on antidepressants. So I look at what we do on this committee as very, very important, because it's not just those few little clinical trials and, the ones that are going before with this nasal spray. There are only, small percent of people.
As you say, there's sort of real life impacts. We've got a little bit of time left, but if you could just briefly tell me, do you think the FDA is now lowering its standards on drug approval?
100% I do. I think the issue is there's all these fast tracking mechanisms that are allowing drug companies to present less than the gold standard of 2 double-blinded placebo-controlled studies, like in this case of this nasal spray.
This nasal spray. Unfortunately, we'll have to leave it there. Kim Witzak, thank you so much for joining us here on the program.